especially in high risk pregnancies, women are very confused how to differentiate false labor pains from true labor pains. So, what is labor actually? So, labor is a process by which the womb decides to expel the baby, right? So, how does it happen, or what are the signs of labor? So the signs of labor are the uterus begins to tighten. Your womb, it starts to feel a little tight. So when you put your hands over your abdomen, you could start feeling something which is like getting a little hardened. Also, there is onset of pain, some kind of menstrual discomfort, which starts in the lower abdomen, then it may progress to the rest of your abdomen, and then maybe to the lower back, and then it goes to the inner margins of thighs, etc. So, this is how the labor pains begin. And one very important factor is that the labor is always something which starts from contractions, say every half an hour, and then the duration, the frequency, and intensity will increase. So, say for example, they will initially start to come every half an hour and last maybe 5 to 10 seconds. But soon enough, the contractions will start happening every 20 minutes, and then the duration will also increase. They may be lasting for maybe 10-15 seconds, and the intensity will also increase, so they do not die down like false labor pains. Okay, so there is hardening of the uterus. You will feel the contractions. There will be some discharge from the vagina most of the times, and this discharge is known as show. So it is basically a plug of mucus passed with some pinkish vaginal discharge which happens. And slowly and steadily, the cervix also begins to dilate. It also starts to open up, right? So, and then there could be some discharge of waters. The bag of waters may also break down. So, this is all that happens when labor begins. How does labor feel? A very important question. A lot of my clients ask, how do we know that we are in labor? It will be a kind of discomfort you've not felt before. Uh, in advanced pregnancy, in latter stages of pregnancy, there is something which is known as a Braxton Hicks contraction. All right. So, a Braxton Hicks contraction is also a painful contraction. It also comes and goes, but the frequency, intensity, and the duration does not increase, and it is not rhythmic. Labor pains are like heavy menstrual cramps. They are crampy pains, they are heavy, and then they are rhythmic. So, if you have a discomfort which is kind of a severe menstrual pain, do think you are in labor, especially if it is accompanied by some kind of vaginal discharge, which is known as show. All right. So, now what to expect when you are in labor? Once you are in labor, labor will progress. So, during the latter parts of pregnancy, you need to be prepared about which hospital to go or how to access your gynecologist or your midwife. So, once you start getting these crampy pains, make arrangements to go to the hospital. You could be in latent phase of labor. Labor has two phases, the latent phase and the active phase of labor. So, latent phase is also the preparatory phase of labor. Preparatory means that the uterus prepares the birth canal or the cervix to expel the baby. So, the latent phase of labor is also the preparatory phase of labor, in which the cervix becomes soft, it becomes thin, and it opens up to expel the baby, right? And then there is an active phase of labor. In the active phase of labor, you will get contractions which last for very long durations. It could be for as long as 45 to 60 seconds also, and you may be getting three contractions every 10 minutes also. So, this is the active phase of labor. And how do you conduct yourself in the latent phase and in the active phase? So, in the latent phase of labor, it is really helpful if you keep moving about, you keep snacking something, You keep drinking a lot of liquids, but once the contractions increase in intensity and your birth canal has opened up by about 3 centimeters, you need to get admitted to a facility where there is there are facilities for monitoring labor, for delivering you, and maybe pain relief also. A very important question that all our clients ask is how to get pain relief during labor. Obviously, these contractions or these labor pains, they are painful. So, one very important question is what do you do to have pain relief during labor? So, for pain relief, you can take paracetamol tablets. You should have your birth partner around. You can use a hot water bag beneath your back. This also helps alleviate or lessen pains of labor. Keep sipping liquids. All right. You should have liquids every 10 to 15 minutes. Listen to some good music that you have been fond, and you can use massaging techniques. Acupressure helps. So all these techniques will help you, tolerate your labor pains better. Keep breathing between contractions because this will also keep you patient as well as provide the necessary oxygen to your baby. And it always helps to prepare for labor in advance. How do you prepare for your labor? So, read about it or listen to experts talk about labor so you know exactly what to expect. Very important is ask questions. Ask your gynecologist how and what do they expect to do, or expect you to how do they expect you to conduct yourself in labor, and how do they expect to assist you in labor. For example, there is something which is known as painless labor or epidural analgesia. So in this, we put in a needle in the patient's back, and through it some medications are given, and then the patient experiences labor. The pain comes, but the sensation is not there. So effectively, the uterus is hardening, the uterus is pushing the baby out, the uterus is expelling the baby out, but the mother is not feeling any pain. So there are a lot of these techniques. A lot of the hospitals now, they are doing water birthing, etc. So very important is that you are aware of the various pain relief methods that can be offered to you in labor. All right. So be well informed. Choose a birthing partner who should be accompanying you during labor. So you have to, speak to somebody in advance who should be there accompanying you through the labor, who understands the process and is ready to support you emotionally and physically. Expect that you could be in labor for close to 12 to 14 hours, because the active phase of labor, the duration where you are going to have heavy contractions, this could well last for 8 to 10 hours. So, and the latent phase could be, another 8 to 10 hours. So, be mentally prepared that you could be in labor for close to 14 to 15 hours, and do not panic. There are techniques by which doctors can assist you. So, do not panic. The crux of this discussion is when to know that you need to move from your home and reach the hospital. I'd repeat again, it would be start of some painful contractions, as in you would be experiencing backache and pain in the lower abdomen, in your thighs. Your uterus would be hardening. There could be some mucus discharge, which could be bloody. And then you could have watery discharge also, which is known as break of waters. And this watery discharge is exactly like urine passing out. You would feel that you have wetted all your clothes. Your clothes would be wet, your bed could be wet, and it could be profuse. It could be like a gush of water. So be ready to make a move once all of this happens, and this will continue happening. It will not die down. All right, so now the house is open for questions. All right, so we have a few questions. So somebody in the audience has asked us, how do I know when to push myself? Okay, so how do you know when to push? Okay, there will be an urge to pass stool as the baby is pushing uh, into deep into your vagina and onto your anus. See, behind the vagina is the anus. So as the baby is pushing down, there will be a strong urge to pass stools. And once there is such an urge to pass stools, you need to understand you want to make a push. And how do you push? You push as if you are straining on stools. You clench your teeth, you hold your thighs towards your abdomen, and you start pushing down. And you push as long as there is a contraction or a pain. Don't push when the uterus is relaxed or between contractions. So once the contractions have died down, that is the time to replenish yourself, have a sip of water, take a deep breath, maybe snack something, and then start pushing again. All right. And what do you do if your baby does not come out, even if you are pushing? See, the duration of pushing or the second stage of labor in the first pregnancy could be close to 2 hours. All right. So you could be asked to be pushing for around 1 to 2 hours. And even if during this duration of pushing, the baby's head is not coming out, and the situation is favorable, then your gynac may want to assist you by applying a forceps or a vacuum device. So a forceps is something like a cup. It's like a metal, it's like two metal clips in which between which the head of the baby is grasped and is taken out, and this is commonly used once somebody wants an epidural or painless analgesia. All right. And then there is something which is known as a vacuum device. Vacuum is like a suction cup, it fits on top of the head of the baby, and the gynecologist extracts the baby out by applying the vacuum cup. So again, expect that you could be pushing for around a couple of hours, and you have to push once there is an urge to defecate or pass stools, or you feel something is pushing down inside your vagina. Any more questions that we can have? Okay, so then there is somebody who asks me, is there any way, uh, what is the most common method to deal with labor pains? A, the most common method is be mentally prepared. You need to be prepared to bear those pains. It is one thing to choose to deliver vaginally, it is another thing to actually deliver and be mentally prepared for it. So be informed. You need to know what is labor going to feel like. All right. And then you need to have emotional support during labor. Believe me, support helps a lot. And then there are analgesia techniques, there are pain relief methods, there are drugs that can be given you. And then there is, as I said, heart fomentation, there is acupressure, there is acupuncture, and the most common technique which is widely available currently is epidural analgesia or painless labor. So, what happens there is that in your spinal cord or in your spine, we give you an injection. It is much like the injection given during a cesarean section. So, we give you an injection, and through that, we put a very thin catheter, and through that catheter or pipe, you get continuous infusion of drugs. And due to that infusion of drugs, you will get the labor pains, but you will not feel them. All right. So, this is about the most common method. It is epidural analgesia and it is pretty safe. So, you need not worry about it. The only thing is that you need to be mentally prepared to get an episiotomy or, if required, forceps or vacuum delivery. And then again, which stage of labor has serious labor pains? The most serious labor pains happen in the second stage of labor. Second stage of labor is the time when the mother is pushing the baby out. This is the time when she has the most serious labor pains, and they could last for around 60 seconds and may come every 2 minutes also. Okay. Okay. So another question is an episiotomy required? If you are a first time delivering mother, it is your first pregnancy and you are delivering for the first time, you could require an episiotomy. You could require an episiotomy if your baby is a little big in size. So, from what we see, most women who have tight pelvis or a tight birth canal and who are delivering for the first time, and the baby is somewhere more than 2.7, 2.8 kg, do require an episiotomy to help them deliver. And then what is episiotomy? So in episiotomy, a cut is made in one wall of the vagina, going laterally, going sideways. It does not go in the midline towards your anus, but it goes sideways in one wall of the vagina. And through this increases the diameter or the cavity of the birth canal to deliver the baby. All right. So any mother who's delivering for the first time has a comparatively tighter birth canal, and the baby weight is a little higher, will require an episiotomy. Okay. And is normal delivery painful? Yes, a normal delivery is painful unless you choose to take one of these pain relief techniques, which is labor analgesia in the form of epidural or painless labor. Yes, the labor pain is painful, but most women who choose to deliver vaginally are able to deal with it. So feel confident, be mentally prepared to have your support system in place, right? And what first, another question, very good question is what first time moms should expect during labor? All right. So the first time moms should expect uh, it to be it is not a short process. A lot of women come to the hospital thinking that they keep hearing from a lot of previously delivered mothers who tell them we just went to the hospital and delivered. Not at all. Be patient, be prepared to be on the labor table for 8 to 10 hours. Yes, and be prepared for the labor pains. You will get contractions which will be like heavy menstrual pains, so be mentally prepared for them. Even when there are these pain relief techniques, which are the epidural labor or the painless labor, but you need to understand they can be given only in active phase of labor. These pain relief methods, they cannot be given to you in latent phase of labor or when the birth canal has opened less than 3 centimeters. Okay, so these birth relief, pain relief techniques, they can only be given to you once your birth canal has opened more than 3 centimeters. So even with whatever techniques we have, you will have to take the initial labor pains. Okay, somebody else asks me, how do I know delivery is near? Okay, another very good question. And this is how you will actually start preparing for labor. You will understand that delivery is near once there is lightning. The baby's head falls down. So, what happens is, as the baby is growing, the uterus starts pushing onto your diaphragm. It goes up, pushes your lung bases up, and then there is difficulty in breathing. What happens is near labor, there is lightning. The baby drops down into your birth canal, and your breath is a little easier. So once this happens, start expecting, that something is going to happen. If the vaginal secretions increase, you may just have an increase in vaginal secretions. It could be a more of a runny discharge, or there could be a lot of mucus coming out. There could be a lot of blood coming out. So once these things start happening, expect labor. If there is amount of discomfort in the back, it always most often starts from the back. Women feel this is backache, but no, it is sometimes the start of labor. So when in the latter half of the pregnancy, in the last stages of pregnancy, you start getting pain in the lower back, start expecting labor. And this lower back pain should not be mistaken for the normal backache of pregnancy. Also, if these things happen after 37 weeks, which is the duration of term pregnancy, term as in the complete duration of pregnancy. So, counting from the first day of your last menstrual period, once you are 37 weeks pregnant, and you start having backache or pain in lower abdomen, or discomfort or contractions or increase in vaginal secretions, start expecting labor. And especially once you start breathing a little easy after 37 weeks, you should start thinking that something is going to happen and start preparing to arrive at the hospital. Okay. And then there is somebody who asks me how many bones break during delivery. No, it's nothing like that. It only feels, this is how the labor pain is quantified. I don't want to scare the expecting moms, but yes, it is said that the pain of labor is equivalent to many bones breaking at once. None of the bones actually break during labor, so do not get scared, do not freak out. Actually, none of this is true. Most women with good analgesia techniques are able to withstand labor pains really well. So feel confident, prepare in advance, read about it, talk to your doctor, and you should be able to handle labor pains and handle your labor really well. Okay. Any more questions from the audience? Okay, so let us conclude. You need to recapitulate the signs of labor. The signs of labor are the contractions that you could feel, discharge, backache, and watery discharge. You could download this app Baby Chakra and use the referral code Bhumika Bhumika. You can follow us on Instagram. You can follow Baby Chakra, or you can follow my page Dr Bhumika Bansal for more such information and videos. Or if you want to reach me, you can reach me at Apollo Hospital Lucknow between 4 o'clock to 9 o'clock on all days except Sundays, and we would be happy to assist you. Okay, so it was nice talking to you, audience. Thank you, and keep in touch for more such information.